There's really three different kinds of outpatient treatment. There's what's called PHP, or partial hospitalization, where you would be receiving services from 5 to 6 hours per day, and you'd typically be residing in your home area or in a sober living environment, and so you would leave the facility at the end of the day. IOP, or intensive outpatient programming, is 2 to 3 hours of treatment a day. And there's also just what we call traditional outpatient, which is usually 1 hour services once a week or as determined by your therapist. The kinds of services you see in all three, in PHP, IOP, and outpatient, are similar. Individual therapy appointments where you're working with a primary counselor on accomplishing your goals, both for substance use and mental health. Group services where you may have process groups where you're working with a therapist on interpersonal communication and life skills, and psychoeducational groups where it's more of a didactic and lecture setting where you're receiving information that will help you maintain healthy habits in recovery, learn about the disease of addiction, get general information about improving your medical and mental well-being. We do a big picture approach where we really look at patients holistically. If you're someone and you're sitting there thinking about, am I a good candidate for outpatient treatment or inpatient treatment, I think that's a good indicator that you might be ready or poised to go seek treatment. And I think that that can be a really pivotal time to change where you are in your life and what you want to accomplish. A lot of the services that you receive in inpatient and outpatient treatment are similar. So it's more about the frequency and duration of those services. And there's many providers that will be able for you to present and just say like, hey, I'm thinking about this, I have this question. And they have assessments where they can evaluate and say, hey, we really think that you would really benefit from outpatient treatment. And you can start there. And there may be some that say, you've been weighing this question yourself, and here are the reasons that we see that we think you'd be most successful in inpatient care. So it is an indicator that there may be something inside you that says it's time to go do that now, and providers will be happy to help find you the right kind of provider that can give you the treatment that you need. And it can also change too. If you end up at an outpatient place and it's determined by either you or your treatment team that inpatient was really better, treatment providers are really well connected and they're looking after your best interests, and they can get you to inpatient, and the contrary is true too.
If there are questions that you would like us to answer or videos you'd love to see, leave us a comment. Thanks again for watching, and don't forget to like and subscribe.